times, perfect timing, right? So for all of you who are parents as well as seeing parents, these are a lot of tips and areas that I focus on, especially during the holidays. So it's really helpful. All of the slides that you'll see today with the tips on them, they are from the Incredible Years, and the Incredible Years is an evidence-based approach. It's a parenting approach that's done in a group setting. It's by Carolyn Webster Stratton. She started the approach based on research from the 1990s and really focused on at-risk families, and it's kind of grown. So the Incredible Years, they even have the Incredible Babies and Incredible Teens, right? So they go all through the different developmental stages. The slides that I've taken, I think, are from the Incredible Children, so kind of that mid-level range. Some of the objectives, I utilized the curriculum, the Incredible Years curriculum, in our MAT program for mothers who are struggling with a substance use disorder, and so we utilize a whole lot of those skills within that program. And so we really talk about parenting stress, but across the board, these are parenting tips that can be utilized throughout. I think I've used it throughout treatment all this month. So for parents who are stressing. But the Incredible Years is really great. It's done in many different forms. So it's done in a group setting, but they utilize and kind of project the skills through vignettes, through small activities, through specific topics. They really focus on increasing social skills, emotional language, problem solving, reducing and managing negative behavior, anger management, and increasing empathy. And so we really try to focus on those different areas, and you can see them pull out in the tips. So we'll start with our first tip. There we go. So our first tip is play, play, play. One of the things that I talk about with parents is that their presence are the most important. I can't remember what article, I meant to look for this because I told somebody about it the other day, but I was reading an article the other day, and it was a small research study that was done on interviewing young adults on their early holiday experiences. And when they interviewed these young adults on what their memories were from their early holiday experiences, they identified that these adults remembered things like something specific that their parents played with them with, a holiday decoration that they always put up with their parents, and then a favorite holiday food that sometimes they helped make. And so it was really not all of these other commercialized items that we think about, like going to see Santa, or I think there was one person that talked about going to see Santa because it was traumatic for them, but that's why they remembered it. But it wasn't going to see Santa or paying $30 to go see lights, or, so I really talk to parents, especially ones who can't afford to keep up with all of these commercialized items, that those aren't the memories that the children remember anyways. And so it's really interesting to see that. And so what I talk to them about really is just about playing with them. So a lot of the times in parenting pieces, we talk about increasing that positive interaction through play. And so I just remind parents that if your kids seem kind of out of sorts, which is natural at this time of the year anyways, so kids need safety, security to feel that predictability, right? And so, or they need predictability to feel that safety and security. And what happens between Thanksgiving and Christmas is that things become completely unpredictable. We're going places, we're doing things, schools are not as routine as they usually are, right? And so that kind of throws kids off. And so we talk about just taking time to play, be there one-on-one, and remembering that time together, really kind of reducing some of the stress there. It actually slows parents down too. So we always talk about, if things seem out of control, if all else fails, sit down and play with your child. So we talk a lot about that. Our tip number 2, and if you guys have any questions, please feel free to ask during. Tip number 2 is noticing positive behaviors. So we talk about how parents hyper-focus on the negative behaviors, right? High stress and wanting kids to do well and to have good behaviors. A lot of the times they're presenting in public, so they want them to act appropriate. And so we talk about really noticing the positive behaviors and how important that is, and kind of reducing that hyper focus on the negative behaviors, because parents tend to do that once you know that your child has a specific behavior, especially if you're working on that. So just remember to notice those positive behaviors. So, you did a great job being patient with me today. I really liked how you took turns with your brother. I really liked how well you guys did in the car ride. Just really focusing on some of those positives so that they don't feel the stress of the holidays. The ironic piece is that parents work so hard so that their kids are happy, but their kids are really just happy with them. And so many of the times we're working so hard to make our kids happy that we're creating this stress in the meantime. And so I really just kind of talk to parents about slowing down with that. Along with noticing the positive, I always talk to parents about praising themselves as well. So and this is actually something that we work a lot on in therapy. It's pretty amazing how difficult it is for some of our parents to praise themselves. But if you think about some of the traumatic cases that we deal with, they don't hear a whole lot of praise. They have a hard time identifying positives within themselves. I mean, everybody does. If I asked everybody here to identify, 2 positives about yourself, that can be a little more difficult than if I said, okay, tell me everything you have to work on, right? We tend to focus on everything we have to work on, but the reality is a strength-based approach, you can utilize those strengths to overcome some of those weaknesses. So we talk to parents about really identifying those areas that you can praise within yourself. If your child sees you getting excited because you've been successful with something, they're going to get excited and celebrate too. And they're going to celebrate themselves, and they'll bring that to you. And so building that relationship, that communication, and that positive interaction is really important. So we talk a lot about positive talk and positive praise. Okay, tip number 3. So we talk a lot about rewards and positive rewards, and to use rewards sparingly. We talk with parents. I have a lot of parents that come off with these big rewards, and we talk about just kind of using spontaneous ones, whether it's a special snack or a small sticker, or, another book at bedtime to read, instead of 1 book, they get 2 books, or, more interaction with the parent. And those are great rewards for children. A lot of the times parents feel like they have to go and get all of these items from the dollar store, or a big item, and really you don't. It's your time that they're looking for. And so I explain to parents that some of those rewards are great, especially spontaneously. Nobody wants to buy extra things around Christmas time because kids are getting Christmas presents. So that's a great time to practice this. And if they're doing great, having a really great day, we're just going to sit down and hang out, or let's sit down and color, all of us, right? And that's really helpful around this time. And again, it kind of slows parents down. It de-stresses. This way you're kind of removing yourself from all of the stress and things that you're doing, and you're just relaxing as well. Not to mention that coloring can be therapeutic within itself. So you can totally use that. But the reward system, the great piece about this too, and especially for kids who have increased behaviors, and when you're trying to manage specific behaviors, I use this a lot with especially foster families and working with them. The first thing that parents want to go to, foster parents, is like consequences. We need to go straight to the consequences. And I talk about incorporating rewards before you do consequences. The limits and limit setting is really helpful. And so that part of the consequences and incorporating compliance training is beneficial. But rewards actually light up that same part of the brain that causes distress. And so a lot of the times when kids who are having a difficult time managing their emotions to begin with, that part of the brain is distressed. And so that part of the brain is overacting right now as it is. And so if you incorporate a reward piece, it's there in that part of the brain. They're more likely to follow through with that than a consequent piece. So a consequent piece would cause them to have to stop and think about it. And right now their brain is not ignited in that area. And so that's not a real big driver for them at times. And many of the times they could care less about that consequence. And a lot of the times that's kind of what happens with compliance training in foster kids, is because then parents give up on it because they feel like that kids don't comply with that. But the reward system is totally linked to that part of the brain, and it's really helpful to help reduce some of that for kids as well. Well, and it also can cause them to get a little hyper at times as well, but one way or the other. All right, so tip number 4. I know I'm talking super fast, so anybody feel free to stop me. Tip number 4. So the biggest piece is just to be present with children. And so again, incorporating them in pieces, wrapping presents with them. And a lot of people are very particular about the way their presents are wrapped, but a lot of people don't care how you wrap your presents. And so helping children, get involved in that, get involved in cooking and cleaning and helping you out. Sometimes it makes a little more work, but thinking ahead of the things that they can do that really don't bother you, that maybe they can accomplish, can be helpful. They need that sense that they've accomplished something as well. And for parents, anytime you need to be more present, I tell parents all the time that if you get an increase of behaviors, your children might be signaling you, right? Signaling you for your attention. And many times parents aren't ready to give attention at that time. Sometimes it's when they're upset with their children. Sometimes it's when they're feeling stressed or overload. So the same thing with play, when you're getting ready to play with your child or when you're getting ready just to be present in one of these activities, just checking in with yourself. So I tell parents all the time, and many of the families I work with, we work on that first before anything, checking in with yourself. If you're not able to check in with yourself, then there's a chance that you're going to create behaviors in some of these activities. And so if you're not in a good space, then you're going to create behaviors in some of these activities. And so checking in with yourself and figuring out what you need to do for you at that time. And I actually, this is a session that I take the whole session for, and we work through what it is that helps reduce your stress at that time. And so for each parent, it's different, but we talk about taking time to yourself, right? Maybe reading, I have one parent that reads positive affirmations before, when they check in with themselves, when they're in a bad space, and that helps them go and interact with their children. There's a lot of parents that don't enjoy playing, don't enjoy incorporating their kids in these kind of things, and that's completely normal. And so we talk about how to get yourself in that space so that you're not responding that and you're controlling those emotions. And so being able to control that so that you are present for your children and you are giving them what they need at that time, even if it's not the most enjoyable for you. And so we talk about deep breathing, we talk about meditation, we talk about taking a walk around the block if you can, right? Walking away from the children for a little bit. We talk about ways to plan your day too, so that you're not doing these things at the most stressful times. Especially if you can identify patterns of where children are distressed the most. So if you know that your child starts climbing the walls at 4 p.m., we talk about ways to prepare for that and work around that and incorporate some of these interactions so that you're prepared for it, you've checked in, you're ready, and then the child, you almost anticipate that to happen, right? Also with this tip is just about, a lot of these pieces too, and this comes straight from the Incredible Years, is, promoting those pro-social behaviors. A lot of the times, just by doing some of this, you can totally promote and incorporate teamwork, taking turns, sharing, right? And this isn't a time where you say, no, you have to share with your brother, you have to share with me, right? It's when you say you're wrapping a present and you need the scissors. They're most likely to hand you the scissors, especially if they're done with them or not using them. And thank you so much for sharing. Super successful. You showed them that they're sharing with you. You're getting overly joyed about that. Great teamwork. We did this together. And so you're showing them all of these pro-social behaviors. And for parents, we talk about, especially parents who are having trouble with their children in daycares or the school setting, interacting with other kids, we talk about ways to do that and promote those pro-social behaviors in their everyday interactions so that it spills over into those areas. So the more that they promote that at home, the more likely they're to engage in that in other areas as well. Okay. And our last tip, see, that was super fast.
That's okay.
So, and our last tip is to unplug your Christmas tree mentally, right? I talk with parents all the time about just reducing your expectations or making your expectations very clear. And so we talk about not expecting perfection, right? Perfection and parenting should not even be in the same sentence because it doesn't happen. And so we talk about not expecting perfection from your children. How many times parents go to, when you spend the holidays, you're going from home to home a lot of the times. And if you're not going from home to home, you're going from event to event. And a lot of the times you're tired, you're hungry, you're exhausted. Guess what? The kids are too. And so a lot of the times that's when you see behaviors escalate. And as parents, we kind of expect our kids to be on their best behaviors everywhere we go. And we're kind of setting them up for failure with that, right? Because we're exhausted, we're hungry, we're tired, and they are too. And so expecting them to be perfect is just unrealistic expectations. It's not going to happen. And a lot of the times, and being around other children, a lot of the times they're going to play with cousins or friends, and that is just increased stimulation. Naturally, they're going to become a little more hyperactive. What you can do a lot of the times when we talk with parents about setting expectations, and so talking about expectations on your way to someone's house or during an event. Okay, so today this is what I expect of you. And if this doesn't happen, this is what's going to happen, right? But again, still not expecting perfection, giving them some wiggle room. So maybe their expectation is, I expect you to listen to me and follow directions when I speak to you here. And if you're not, you need to calm down a little. We're going to go to another space, right? And so really it's a timeout, but you're just telling them that they're going to go calm down a little bit. But that's what they need. They need to kind of reduce that. And especially if you get kids that get overstimulated, right? And so that overstimulation occurs. For older kids, they get hyperactive. That's when you can get a lot of behaviors. For younger kids, like toddlers and infants, that's when you can get, crying. They can vomit a lot of the times, have physical responses, fevers. And so really just helping identify that and reducing some of that stimulation, it can be really helpful. A quick story for you guys. So my daughter, she's 11 now, so she'd probably kill me for telling people this, but when she was a baby, she would totally become overstimulated. We have a large family, and so everywhere we went, there was a lot of people, and every holiday you could guarantee her starting to vomit and spike a fever. And so we finally realized that she was becoming overstimulated. So if you would strip her naked and place her in the corner of the room by herself, she was totally fine. So paying attention to that stimulation is really important. It can be really helpful, and it can change their behaviors altogether. But also increasing your routine and your schedule can be very helpful as well. And so a lot of the times we also prepare for the fact that the children are going to be off for a long period of time. And so in that time frame, trying to have a schedule or routine. And if you want it more laid back, totally fine. Just tell the kids every day what you're doing. And so that goes the same thing with expectations. By reporting to them what your expectations are, we're telling them what we need to see from them. By telling them every day what's going to happen, you're kind of giving them that predictability. Kids need that, and a lot of the times as parents, we're already thinking that. We just don't verbalize that. And so it's really important to verbalize that for children. They're not mind readers, and we need them to understand what's going to happen to them. And especially when you're dealing with kids who have experienced early childhood trauma or in foster care. They need to know what's coming next, and sometimes they need to know what's going to happen. A lot of my foster families, for kids who've not experienced holidays, I always recommend them to keep it low key. I have a couple families that get so excited that they get to help these kids experience something that they've never experienced before. So they make all these great trips and events and plans, and it's too much. The kids have extreme behaviors. They talk about how horrible it is and how difficult it was for them. But the reality is that's too overstimulating. Some of the kids that we work with have never experienced that. They don't know how to handle it. They don't know how to manage it. And so they don't know how to interact with that. And so a lot of the times I work with parents on those verbalizations. So just verbalizing step by step what's going to happen and how they need to respond and act. So sometimes for kids who have not had a holiday experience, where they might have went to a family's house and ate dinner and then opened presents and then just hung out with each other, right? Telling them that this is what's going to happen will help reduce some of their hyperactivity and anxiety about going. And then you're reducing some of those behaviors and those outbursts, but also taking another step at times and telling them how you expect them to behave in these settings, right? And so when somebody hands you something, I expect you to say thank you, or, you know, I expect you to be polite about your food, and this is what it looks like, and this is what you do. And we don't always think about preparing kids in that way, but for kids who have never experienced that, it's really difficult for them. And so they almost don't know what kind of expectations to have, so you're placing those there for them. That's all. Any questions about any of that?
Well, that was wonderful. We enjoyed it a lot.
That was
I'm glad you enjoyed it.
And we had an excellent comment left about how much they appreciated it and that it was excellent content, and they'll be in touch.
Fantastic.
Thank you so much, Amanda.
You're welcome.
Very useful information for this time of year. I personally loved when you said, don't forget to praise yourself. Caitlin and I were saying how important that is. And
It is.
so,
Think about it.
yeah, so we really appreciate it. Thank you for your time. Were there any other comments or questions all of you had out there for Amanda? And again, if you're having trouble with any microphone or sound issue, you can feel free to chat us as well, and we'll ask the question for you.
I'm going to take a second here to read a question that we had emailed into us. It's actually, I think, been answered, but just so everybody's aware that we're going to discuss it. But we had a question emailed in for Psych Echo, and it was how to engage with parents in the child's care plan, and especially when the parents need to be the people modeling the behaviors and attitudes, and how to make sure you broach that topic without putting them on a defensive. So I'm going to ask Amanda, but I'm also going to ask all of you guys if you have any tips, tricks, comments.
Anybody do something specific that is successful for you in treatment?
You can always unmute yourself or throw up a hand and we can unmute you.
Well, one of the things to take into consideration, and I think that, you know, child work is so much more than individual work, and it's because you have to take these things into consideration. And other things that you need to take into consideration when you're, you know, when you respond to something like that is the developmental stage. So where the child is developmentally, their chronological age, right, and the type of treatment that you're engaging them in. And so depending on the type of treatment that you're engaging, if it is individual therapy, anytime you're working with a child 5 and under, you want to include the family, right? You're not going to make success without the family included. And I actually make it, it becomes very routine that I meet with the family and then the child separately. If I do individual, the only time I really do individual with kids 5 and under is for trauma work. But I'm still incorporating the family because that's really important. For kids who are older than that, so the preteen age, you still incorporate the family a whole lot as well. And so really just engaging the family from the very beginning is important. When you move into teens, they don't particularly like the parents to be involved. Yeah. And so that's, and sometimes within the preteens too, they'll be like, I don't want my parents involved in that. And so I'm very open in communication with my patients, and we talk about that and I explain to them. And there are times that I meet with the parents alone. The preteens start to question that, and the adolescents, I don't usually do that because unless there's something specific we're working on, but I'm very upfront with what we're working on so that they don't feel like we're talking about them, right? Because that's always that developmental stage, they seem to question that. And so we really kind of talk about the separate goals that are occurring at that time. And so, you know, a lot of times if it's a parenting piece, we talk about the parenting pieces. And it all goes back to your treatment plan as well. And so in my goals, I usually include for children, I usually include an individual goal, a community goal, and a family goal. And so incorporating that family goal, there's something we have to work on within the family. And so pulling them in and engaging them is important. And so that's kind of, you know, that's kind of my out for my preteens and my adolescents. Like, this is a goal that we're all working on. So I have to pull your family in. And so, we engage in that way. Sometimes parents don't want to engage, even with my younger children that I work with. You know, I specialize in 5 and under, and I focus on that age range. And, you know, sometimes I think of, in particular, I just had a little 3-year-old that has high anxiety, and I mean, we can work on techniques all day long, but the reality is that we need the parents involved if we're going to incorporate the techniques at that point in time, because cognitively that child's not going to be able to pull those techniques in at the right time. And so the parent really did not want to be involved, and so but wanted them in treatment. So then you focus on individual treatment, grounding techniques. I mean, that's really all you can do. That's not my specialty area, so I usually refer out at that time, because you know, my core approach is a strength-based family approach. And so I have a really hard time with the individual piece, but a lot of parents push for that. So definitely understand that.
Thank you. I had actually a quick question too after all of that. So I loved when you mentioned the individual family and community goals. So tying it back to, like, let's say the holiday season, would a community goal, for instance, be something like a holiday event in your town or city that you can go with your family? And would that be sort of an overlap with a family and individual goal as well?
Yeah, absolutely. So, and depending on what a child is working on, right? Like, I have one child, and you can totally tailor it to the holidays. And so I have one child that I'm working with now. She's 11, and one of her community goals is that she is able to follow direction and reduce her hyperactivity. I mean, naturally, she knows what those mean, right? Like, we've been working on those pieces. So they have to know what the goal means, but naturally she knows what she needs to do, and we've done enough coping strategies to where she can control her hyperactivity, right, when she gets very stimulated and excited. And so they were going to a tree lighting, and so her goal was to be able to reduce that and incorporate her coping strategies at that time. And so we talked about, so it was a 4-hour period of time, and so she had to incorporate her coping strategies for that 80% of the time, because she's worked very hard. Now, if we were in the beginning of treatment, I would probably make it like a 40% of the time, but she's been working very hard, so we definitely incorporate that. And yes, I have a lot of community goals that overlap with family goals. You know, a lot of the times we have families who are just completely disconnected and have a difficult time even verbalizing that connection. And so having them identify how they want to go out into the community together. You know, it's amazing how many families I have that wait for our therapy sessions to even have that kind of discussion. Like, they don't even discuss that amongst themselves. And so, because they don't know how. And so then having that discussion and incorporating that. Yeah.
Thank you. Does anyone have any questions or comments after that as well? Feel free to chat us as well if you'd like. I see we have some people who came in recently too, so feel free to unmute yourself or chat us if you have any questions. I guess, I mean, I could sit here and ask you so many questions. I don't want to bombard you with all of those, but we have about 20 more minutes left. We do have one announcement that I can think of off the top of my head. So the session that is on January 1st is canceled just because it's the first day of the new year. So our next session will be on January 15th. And that one is actually going to be starting at 12:30 and finishing at 1:30. So that one in particular will be half an hour later than the first session of the month. So that will be Dr. Goody Coons will be providing our didactic for that one. Is there anything else you can think of? Okay, yeah. So we will be accepting cases throughout the holiday season as well. So feel free to continue submitting cases. Feel free to email us with questions or comments or didactic ideas. If you have any topics that you would like to have addressed, we will certainly have those addressed in future sessions. And we will send out the flyers for the 2020 schedule as well. And in the recap email, I will attach all of Amanda's holiday tips that she went through for us today. So all of that will be sent out to you guys. So thank you so much for stopping in today. We really appreciate it. We always love seeing you guys stop in, and even if you have to leave early or come in a little later. So thank you all very much, and have a wonderful holiday season and a Happy New Year. Thanks, guys.
Happy holidays.
Bye.
Bye. And we had another comment on your didactic.